Currently, there are many people who are addicted to alcohol or drugs, and because of this trend, our culture is affected negatively. This may seem like a small problem considering marijuana has been legalized in over 30 states, alcohol is legal in every state, and not to mention the ongoing need to have access to painkillers for use with a prescription. As an independently licensed substance abuse counselor in the state of Ohio, I have worked with countless people who have no desire to change their behaviors because it is what's cool, it's what everyone else is doing, and it's legal, so there's no reason to change it. And this is the message that resonates within the complex culture as a habit acquired as a member of society. This is where I sought to identify ways to improve the substance abuse treatment process. Within this process, people participate in AA or NA meetings or attend group counseling or even seek help dealing with specialized mental health concerns. Oftentimes, the dedicated staff have a hard time figuring out whether the clients have a mental health disorder or a substance use disorder because they mimic each other in what's considered a dual diagnosis. So these clients are being treated for one problem and not the other problem, or more importantly, no problem is being treated at all. Tobacco and caffeine have been synonymous with recovery efforts, and tobacco can be seen smoked in between group breaks, while coffee can be seen at various 12-step meetings for the participants to drink. It is almost as though recovery has its own culture of norms and expectations to attend groups, work the steps, and stay out of trouble. However, this set of recovery efforts has been proven to be counterproductive to the recovery efforts that they actually seek to attain. Tobacco is the leading cause of death for patients with an addictive disorder or psychiatric illness, while caffeine is associated with greater withdrawal symptoms and the potentiation of toxic effects of alcohol and drugs, or AOD. Research has shown that an underlying diagnosis exists in a vast majority of cases. This information suggests that a need for the treatment of tobacco and caffeine as a primary condition to support long-term sobriety for other AOD. The goal of the Action Research Plan is to develop an interchangeable curriculum to use within an intervention to create an altered focus in reality, which means we no longer want to focus on the substances such as marijuana or alcohol or opioids, and instead we want to focus on dealing with the tobacco and caffeine first. One of the primary tenets of cognitive behavior therapy is to identify the negative behaviors that created problems in our lives and replace them with more appropriate, healthy behaviors. The concept is that if we just take away the negative behaviors, there will be blocks of time or emptiness that would at some point need to be filled. If they are not occupied properly with the appropriate client-specific behaviors, it is a given that the old behaviors will return. There have been some efforts to complete this task, but this approach leads to the akin of continued use. Nicotine replacement therapy is often utilized in these programs by prescribing gum with lower amounts of nicotine and slowly reducing the nicotine content over time until reaching zero nicotine. This approach has been successful for some, but is problematic because it takes months or even years to get to the point where there is no nicotine intake. The best approach for this circumstance is the introduction of natural replacement therapy. Natural replacement therapy aligns with the tenets of CBT because the goal is to replace the negative behaviors and the negative substances and replace them with healthy behaviors and healthy substances. The coffee alternative would easily replace the caffeinated coffee used in the 12-step meetings, and the herbal vape pens or herbal cigarettes will easily replace its unhealthy counterparts to create immediate results for those committed to the action stage of change. The ideal population to involve in this type of action research are people in the action stage of change who want to change their circumstances related to their use of AOD. This would also include the parents or role models who understand that children of parents who smoke or drink coffee also have a greater chance of smoking or drinking coffee and, most importantly, doing other drugs. This speaks volumes on the research that was conducted by Albert Bandura, which showed that the risky behavior of an adult was visually passed to a small child through observing and imitation. This behavior was documented through the changes in how the child played with their doll more aggressively and changed the way that we view psychology. When starting this kind of research using the AR cycle, there may be some critical steps needed to improve the odds of beneficial research. There are many versions and variations of the AR cycle used to solve problems. However, I'll be using the model present within the Action Research textbook written by E.T. Stringer. This AR model utilizes a 3-step process of look, think, act to generate and gather data, reflect and analyze, and implement practical solutions. Of these 3 steps, the look aspect of the framework contains the most important steps to consider in research. This aspect of the framework is one of the most important because the entire process revolves around the problem that was identified by the stakeholders. The problem must be established by understanding the context, people, and factors associated with the problem being solved to generate a clear and concise representation of the issue being resolved. The data collection procedures will also need to be consistent and accurate so that all the data is reliable and valid. If a study does not ethically contain reliable and valid procedures and data, then the study cannot be published or added to the prior knowledge on the topic. The instruments used in the study help to determine the type of information that is gathered and helps to shape the direction of the study altogether. Another important obstacle that could occur is not described within the NRT and CBT approach. The funding for this project has not been established and could pose a risk in its implementation. The study seeks to use an ebook to disseminate the materials, which will require the use of 30 ebooks for the participants and an additional 10 ebooks to ensure that there are enough in case of defect or improper care. Working at Golden Finish as a professional development manager, I am charged with the task of creating a curriculum and intervention that is effective against addiction for the target population. In order to complete this task, a feasibility study was completed to determine the levels of interest in the urban community for natural replacement therapy. In that feasibility study, a sample population of 30 people were given NRT herbal cigarettes, and they were given a questionnaire to determine their awareness levels of natural replacement therapy, the consequences of smoking cigarettes, the benefits of using natural replacement therapy herbal cigarettes, and if they would be willing to use herbal cigarettes if there were a free option for treatment. As a result, it was determined that 1/3 of the cigarette smokers stated that they would be interested in using natural replacement therapy, suggesting that there was enough interest to conduct further research. In the next phase of research, there are 2 prospective topics to consider for the research study. The previous study gauged interest levels and knowledge of natural replacement therapy and cigarette use, and any new study will have to expound upon these results. The topics to consider based on the previous study are whether to complete a study A, to document the interest levels of using NRT herbal vape pen instead of cigarettes and NRT herbal coffee instead of regular coffee. B, to document the efficacy of using the NRT herbal vape pen instead of herbal cigarettes and NRT herbal coffee instead of regular coffee. And C, to document the efficacy of the new interchangeable primary, secondary, and tertiary curriculum, NRT herbal vape pen and NRT herbal coffee used in conjunction over a 4 to 12 week period. Of the 3 options, I would be open to complete a study that combined all 3 options over a 16-week period. If each of the studies were to be conducted, they could be done in phases, with each phase leading to the next phase, i.e. phases 1, 2, and 3. The effectiveness of the plan will be measured by the interventions, which collect data with the interest level questionnaires, chi-squared test to measure significance of difference between this study and the prior study, and pre-test and post-test scores to determine if there were enough statistically significant improvements caused by the intervention. The AR plan will use all 3 of these phases to complete the study and collect data.